It's a new day. This is CBS 12 News at 9 a.m.
Well, back here at CBS 12 News at 9, we got a lot of new people moving to Florida. Here's something you got to remember to protect your skin, and this is National Skin Cancer Awareness Month.
Yeah, it's something we should be doing all year long, but it's also very important during the summertime, and it's also especially important because we've seen a rise in melanoma rates doubling over the last 30 years.
Yeah, so it's exciting. We've got guests here in the studio, and they brought sunscreen for us, which is very important. Dr. Jeffrey Fromowitz joining us. He is a dermatologist at the Dermatology of Boca Raton, and Joe Sardano, CEO at the Census Healthcare in Boca. Thank you guys for joining us this morning.
Thank you.
Thank you.
Dr. Fromowitz, we want to start with a question for you this morning. Let's talk about skin cancer becoming an epidemic. Why is it so prevalent right now?
So it's a great question. Skin cancer rates have been rising for the last several decades, and in fact, to epidemic proportions. We're seeing 3.6 million new cases annually of basal cell, 1.8 million cases in the U.S. of squamous cell, and over 200,000 cases of melanoma. We think it's a reflection of people's sun behavior, how much sun we're getting, the fact that the world's getting warmer, we're getting more ultraviolet radiation, and the rates are really exploding. So it's truly something we need to be aware of and get on top of.
And we do that by undergoing checkups. We should be doing that every single year. How have you seen COVID-19 and the pandemic impact how many people are coming in for checkups?
So COVID was a struggle for us because people were fearful of leaving their house and coming to the medical offices. Since then, what we're finding, though, is cancers are larger. They're more difficult to treat because people have delayed. So I think the most important message is get screened, come back to the doctor. It's safe. We're taking precautions in the office to keep you safe, but it's critically important to get checked.
You know, it's so important here in South Florida, too. The sun is obviously very strong, but, something I think people might not think about is, you just walk out to get your mail and you're exposing yourself to that sun. So how do we avoid, what are some good tips here?
It's a fabulous question. First of all, we get sun every day, all the time. Sitting by the window in our house, going to the car, picking up your kids from school, walking to the mailbox. So it's very easy. Make sunscreen application a part of your day as commonly as brushing your teeth. When I wake up, I brush my teeth, get ready for the day. First thing I do, put on sunscreen. You've got an easy container as a great example. Keep it by your toothbrush. Remember, you've got to reapply. Sunscreen doesn't last all day. If you're sweating a lot, if you've dipped in the water, if you're at the pool or you're playing sports, you've got to reapply. With golfers, we say when you hit the back nine, take a pause and reapply your sunscreen. But the other key is get a broad spectrum sunscreen, protects UVA, UVB, and equally importantly, you have to use enough. We tend to under-apply sunscreen, so we're not really getting its full effectiveness.
Joe, tell us a little bit about Census Healthcare. You have some technology to help treat skin cancer. Tell us about that.
Correct. We have a medical device that treats skin cancer non-invasively. In the past, people have had to have surgery. We're providing doctors and their patients an opportunity to have a choice in treatment, and skin cancer is one of those things that requires a very invasive way of treating it. And with SRT, or superficial radiation therapy, patients can go in and not worry about any pain. There's no cutting, there's no bleeding, there's no stitching, and best of all, there's no scarring. And so our job is to manufacture new technologies, great technologies, and when you take these technologies and put it in the hands of great doctors, the patients win. It's a win-win for everybody, and that's what's important to us, is making sure that we put great technologies in the hands of great doctors. My suggestion to patients, as Dr. Fromowitz said, if you have skin cancer, if somebody tells you have skin cancer, look for a doctor that has SRT along with the ability of doing Mohs surgery, because that doctor has the best interest of the patient in mind. And that's why we do this thing for our patients. So.
Yeah, and for anyone who might be afraid of surgery, this is a significant breakthrough in technology.
Well, it's huge, particularly with the aging population that we have, which it normally affects patients as they get older. You have pre-existing conditions. You have patients with diabetes. You have patients that are on beta blockers or blood thinners. This is something that helps them, and it helps the doctors as well, because they're able to manage the patient condition a whole lot better using SRT with those types of patients.
And is it this technology and the advancements in technology that we're seeing, the reasons why maybe melanoma and some of the things that Dr. Fromowitz are going up, but we're not seeing as many people die from skin cancer?
Well, I think that that's fact, and I think the awareness programs that both the doctors and the things that you're doing right now is very, very important. The things that we're doing is very, very important, but being able to provide patients with the opportunity to go and see the doc, because like you said, they're afraid. And you know, when you have a patient that walks out of their neighborhood with a freckle and comes back with 20 or 30 stitches, 100 people know about it, and then they become afraid and they become worried about it.
Right.
Don't be afraid of it. Attack it. Go see your doctor. Get your screening, and then you'll have the treatment that you need.
And early detection is key. We know that when you diagnose melanoma early, 5-year survival rates are around 99%. So if you get diagnosed early by routine skin checks, it's a curable disease. That's why our death rates are down.
That's great. Dr. Fromowitz, Joe, thank you so much for joining us. This is such an important thing, not just this month for Skin Cancer Awareness Month, but for all months, all the time, for people to be safe.
Thank you.
Thank
Appreciate
you.
it.